Introduction to Microdermabrasion. Microdermabrasion is a non-invasive cosmetic procedure that gently exfoliates the outermost layer of the skin. This technique aims to improve skin texture, tone, and overall appearance by removing dead skin cells. It is widely recognized for its ability to address various superficial skin concerns without significant downtime. The procedure utilizes specialized equipment to achieve controlled exfoliation, promoting a smoother and more radiant complexion. Understanding its fundamental principles is crucial for effective application. This introductory section lays the groundwork for grasping the entire treatment process. It serves as a foundational overview before delving into more technical aspects. The primary goal of microdermabrasion is to stimulate cellular renewal and enhance the skin's natural regenerative processes. By removing the stratum corneum, it allows for better penetration of skincare products and encourages the growth of new, healthy skin cells. This leads to a reduction in the appearance of fine lines, mild acne scars, and hyperpigmentation. The treatment is suitable for most skin types, making it a versatile option in aesthetic practices. Proper client selection and preparation are key to achieving desired outcomes and ensuring client satisfaction. History and evolution. The concept of skin exfoliation dates back to ancient civilizations, where various abrasive materials were used to improve skin appearance. Early forms involved using sand, alabaster, or even rough cloths to manually abrade the skin. These rudimentary methods, while effective to some extent, lacked precision and often led to inconsistent results or irritation. The desire for smoother, clearer skin has been a constant throughout human history, driving continuous innovation in dermatological practices. Understanding this historical context helps appreciate the advancements made in modern microdermabrasion techniques. It highlights the long-standing human quest for aesthetic improvement. Modern microdermabrasion, as we know it, began to emerge in the 1980s, primarily developed in Italy. This marked a significant shift towards controlled and precise mechanical exfoliation using specialized machines. The initial systems utilized fine crystals, typically aluminium oxide, propelled onto the skin and then vacuumed away. Over time, diamond-tip microdermabrasion was introduced, offering a crystal-free alternative that became increasingly popular. These technological advancements have made the procedure safer, more effective, and widely accessible in aesthetic clinics globally. The evolution continues with ongoing refinements in equipment and techniques. Anatomy of the skin. The skin, the body's largest organ, comprises three primary layers: the epidermis, dermis, and hypodermis. Microdermabrasion primarily targets the epidermis, the outermost layer, which is responsible for protection. The epidermis itself consists of 5 sublayers, with the stratum corneum being the most superficial. This outermost layer is composed of dead skin cells, or corneocytes, which are constantly shed and replaced. Understanding these layers is fundamental to performing microdermabrasion safely and effectively. The procedure aims to remove a controlled amount of the stratum corneum without penetrating deeper into the living layers. Proper knowledge prevents damage and ensures optimal results. Beneath the epidermis lies the dermis, a thicker layer containing connective tissue, hair follicles, sweat glands, and nerve endings. The dermis is rich in collagen and elastin fibers, which provide the skin with strength, elasticity, and suppleness. While microdermabrasion does not directly target the dermis, its exfoliation of the epidermis can indirectly stimulate dermal activity. This stimulation can lead to improved collagen production over time, contributing to the skin's firmness and youthful appearance. The deepest layer, the hypodermis, primarily consists of fat and connective tissue, serving as insulation and energy storage. Physiology of the skin. Skin physiology encompasses the functions and processes that maintain skin health and appearance. A key process is cell turnover, where new skin cells are generated in the basal layer of the epidermis and migrate upwards. As they reach the surface, they flatten, harden, and eventually become corneocytes, forming the protective stratum corneum. This entire cycle typically takes about 28 days in young adults, but slows with age. Microdermabrasion accelerates this natural exfoliation process, encouraging faster cell renewal. This stimulation helps to reveal fresher, younger-looking skin more quickly. Understanding cell turnover rates is vital for determining appropriate treatment frequency. Collagen and elastin are critical proteins found in the dermis, playing pivotal roles in skin structure and elasticity. Collagen provides strength and firmness, forming a robust scaffold that supports the skin. Elastin, conversely, gives the skin its ability to stretch and recoil, maintaining its suppleness. As we age, the production of these proteins naturally declines, leading to wrinkles and sagging. While microdermabrasion primarily acts on the epidermis, the gentle trauma and vacuum suction can indirectly stimulate fibroblasts in the dermis. This stimulation may encourage increased production of collagen and elastin, contributing to improved skin firmness over time. Skin types and conditions. Identifying different skin types is a crucial first step before performing any aesthetic treatment, including microdermabrasion. The 4 primary skin types are normal, oily, dry, and combination, each with unique characteristics and needs. Normal skin is balanced, neither too oily nor too dry, with minimal imperfections. Oily skin often presents with excess sebum production, leading to shine, enlarged pores, and a propensity for breakouts. Dry skin typically feels tight, may appear flaky, and lacks natural oils. Combination skin exhibits both oily and dry areas, commonly an oily T-zone and drier cheeks. Proper identification ensures tailored treatment plans and product recommendations. Beyond basic skin types, various skin conditions can influence the suitability and outcome of microdermabrasion. Conditions like acne, hyperpigmentation, e.g., sunspots, melasma, fine lines, and mild scarring are often targeted by this procedure. However, certain conditions, such as active rosacea, eczema, or severe acne, may contraindicate treatment. It is essential to thoroughly assess the client's skin condition, looking for signs of inflammation, sensitivity, or compromised barrier function. A detailed visual examination and client history are indispensable for making informed decisions and ensuring client safety. Common skin concerns. Microdermabrasion is highly effective in addressing a range of common superficial skin concerns, making it a popular choice for many clients. One primary target is dull or rough skin texture, which benefits significantly from the removal of dead skin cells. This exfoliation reveals a smoother, more luminous complexion. Fine lines and wrinkles, particularly those caused by dehydration or superficial damage, can also be softened over a series of treatments. The procedure helps to improve the overall evenness of skin tone and texture, contributing to a more youthful appearance. Clients often report a feeling of freshness and revitalization after treatment. Another significant concern effectively treated by microdermabrasion is mild hyperpigmentation, such as sunspots or post-inflammatory hyperpigmentation from healed acne. By exfoliating the pigmented surface cells, the treatment helps to lighten and even out skin discoloration. It can also be beneficial for reducing the appearance of enlarged pores and improving the clarity of congested skin. While not a treatment for active acne, it can help manage mild breakouts and improve the appearance of superficial acne scars. Consistent treatments are often recommended for optimal and lasting results across these various concerns. Mechanism of action. The mechanism of action for microdermabrasion involves controlled mechanical exfoliation of the stratum corneum, the outermost layer of the epidermis. This is achieved through either the projection of fine crystals onto the skin or the use of a diamond-tipped wand. The abrasive action physically removes dead and damaged skin cells from the surface. Simultaneously, a vacuum suction component lifts the skin, drawing it towards the handpiece, which enhances the exfoliation process. This suction also removes the exfoliated debris and stimulates blood flow and lymphatic drainage. The controlled removal of surface cells signals the skin to accelerate its natural cell renewal process. promoting the growth of healthier, newer cells. This process is gentle yet effective in improving skin texture and tone. The gentle trauma induced by microdermabrasion triggers a wound healing response in the skin, albeit a very mild one. This response encourages the production of new collagen and elastin fibers in the dermis, although indirectly. The increased blood circulation brings more oxygen and nutrients to the skin cells, further supporting their regeneration. By removing the barrier of dead skin cells, the skin becomes more receptive to topical skincare products, allowing active ingredients to penetrate deeper and work more effectively. This synergistic effect contributes to the overall improvement in skin health and appearance, making microdermabrasion a valuable treatment for various cosmetic concerns. Types of microdermabrasion. There are two primary types of microdermabrasion widely used in aesthetic practices: crystal microdermabrasion and diamond tip microdermabrasion. Crystal microdermabrasion utilizes a handpiece that sprays fine crystals, typically aluminium oxide or sodium bicarbonate, onto the skin. These crystals abrade the skin's surface, and a vacuum system simultaneously suctions away the exfoliated skin cells and used crystals. This method offers adjustable intensity based on crystal flow and vacuum pressure. It is known for its effectiveness in deep exfoliation and can be particularly beneficial for thicker, oilier skin types. Proper disposal of used crystals is essential for hygiene. Diamond tip microdermabrasion, conversely, employs a diamond-tipped wand to abrade the skin. The wand's tip is encrusted with tiny diamonds of varying coarseness, allowing for precise control over the level of exfoliation. This crystal-free method is often preferred for sensitive areas, such as around the eyes and mouth, and for clients who may be sensitive to crystal particles. The exfoliated dead skin cells are simply vacuumed away, eliminating the risk of crystal residue. Both methods aim to achieve similar results, but the choice between them often depends on the client's skin type, specific concerns, and the practitioner's preference and equipment availability. Each type offers distinct advantages. Equipment and supplies. Performing microdermabrasion requires specific equipment and a range of consumable supplies. The core piece of equipment is the microdermabrasion machine itself, which typically includes a pump to create vacuum suction, a motor for crystal projection in crystal systems, and various controls for adjusting intensity. Handpieces are essential attachments that deliver the abrasive action to the skin. These come in different sizes and shapes to accommodate various facial and body contours. Regular maintenance and calibration of the machine are vital for consistent performance and safety. Proper understanding of each component ensures effective operation. Consumable supplies vary depending on the type of microdermabrasion. For crystal systems, a supply of high-purity aluminum oxide or sodium bicarbonate crystals is necessary. These crystals are single-use to maintain hygiene and efficacy. For diamond-tip systems, various diamond-tipped wands with different grit sizes are required to customize the treatment intensity. Other essential supplies include disposable gloves, sanitizing solutions, pre-treatment cleansers, post-treatment moisturizers and sunscreens, cotton pads and gauze, protective eyewear for both client and practitioner. All supplies must be professional grade and stored appropriately to ensure client safety and treatment effectiveness. Client consultation and assessment. A thorough client consultation and assessment are paramount before performing any microdermabrasion treatment. This initial step involves gathering comprehensive information about the client's medical history, current medications, allergies, and previous aesthetic treatments. It is crucial to identify any contraindications that might make the procedure unsafe or ineffective. Discussion of the client's skin concerns, expectations, and desired outcomes is also vital. This ensures alignment between the client's goals and what microdermabrasion can realistically achieve. A detailed consultation builds trust and establishes a clear understanding of the treatment plan. The physical assessment of the client's skin involves a visual examination under good lighting and palpation to determine skin type, condition, and sensitivity. The practitioner should look for signs of active infections, inflammation, open lesions, or severe acne. Documenting the skin's current state, including any existing pigmentation, scarring, or textural irregularities, is essential for tracking progress. Photographs can be a valuable tool for before and after comparisons. Based on this comprehensive assessment, the practitioner can then recommend a most appropriate microdermabrasion technique, intensity, and number of sessions, ensuring a customized and safe approach. Contraindications and precautions. Understanding contraindications is critical for client safety and preventing adverse reactions during microdermabrasion. Absolute contraindications mean the treatment should not be performed under any circumstances. These include active acne, grades 3 to 4, active herpes simplex, cold sores, open sores or lesions, recent chemical peel or laser treatment within 2 to 4 weeks, use of Accutane, isotretinoin, within the last 6 to 12 months, uncontrolled diabetes, autoimmune diseases affecting the skin, fragile capillaries or rosacea, severe, skin cancer. Performing microdermabrasion on clients with these conditions can lead to severe irritation, infection, or exacerbate existing issues. A thorough medical history review is essential to identify these risks. Precautions involve situations where microdermabrasion may be performed with caution or require modifications. These include mild rosacea, non-active, pregnancy or breastfeeding, consult with physician, use of topical retinoids, discontinue 3 to 5 days prior, history of cold sores, prophylactic antiviral may be needed, thin or sensitive skin, allergies to aluminum oxide for crystal microdermabrasion. In such cases, the practitioner must adjust treatment intensity, choose a gentler method, for example diamond tip with finer grit, or recommend alternative treatments. Always prioritize client safety and comfort, and when in doubt, refer the client to a medical professional for clearance. Treatment protocols. Face. Executing a microdermabrasion treatment on the face requires a systematic approach to ensure safety and effectiveness. The first step is thorough cleansing of the skin to remove makeup, oil, and impurities. This prepares the surface for optimal exfoliation. Next, the client's eyes and hair should be protected with appropriate coverings. The practitioner then selects the correct handpiece and tip/crystal setting based on the client's skin type and concerns. A patch test on a less visible area, like behind the ear, is advisable for very sensitive skin. Maintaining consistent pressure and speed is crucial for ease in exfoliation. During the treatment, the handpiece is moved across the skin in a systematic pattern, typically in short, even strokes against the direction of hair growth. The number of passes over each area depends on the client's skin tolerance and desired intensity. Areas like the nose and chin may require more passes due to congestion, while sensitive areas like the forehead and cheeks need a lighter touch. The vacuum suction should be adjusted to lift the skin gently without causing excessive pulling or bruising. After completing the exfoliation, any remaining debris is wiped away and the skin is toned. Finally, a soothing serum, moisturizer, and broad-spectrum SPF are applied to protect and nourish the freshly exfoliated skin. Treatment protocols. Body microdermabrasion is not limited to facial treatments. It can also be effectively applied to various body areas to improve skin texture and address specific concerns. Common body treatment areas include the neck, décolleté, hands, arms, back, and even legs. The principles remain similar to facial protocols, but adjustments are necessary due to differences in skin thickness, sensitivity, and surface area. Thorough cleansing and protection of sensitive areas are still the initial steps. The practitioner must assess the body skin's condition, looking for areas of dryness, roughness, sun damage, or mild scarring. This assessment guides the choice of handpiece and intensity. When treating body areas, larger handpieces or tips may be used to cover broader surfaces more efficiently. The pressure and number of passes should be carefully calibrated, as body skin can sometimes be thicker or, conversely, more delicate in certain regions like the décolleté. For areas like the back, which often suffer from acne or sun damage, a more aggressive approach might be suitable. while the hands and décolleté require gentler treatment. Consistent, overlapping strokes are essential to ensure even exfoliation and avoid streaking. Post-treatment, a hydrating and protective body lotion with SPF is applied, just as with facial treatments, to soothe and safeguard the newly exposed skin. Client comfort and safety are paramount throughout the entire process. Post-treatment care. Proper post-treatment care is crucial for optimizing results, minimizing side effects, and ensuring client satisfaction after microdermabrasion. Immediately following the procedure, the skin may appear slightly pink or flushed, similar to a mild sunburn. It is essential to apply a soothing, hydrating serum or moisturizer to calm the skin and replenish its moisture barrier. Clients must be advised to avoid direct sun exposure and diligently use a broad-spectrum sunscreen with an SPF of 30 or higher, even on cloudy days. Sun protection prevents hyperpigmentation and protects the newly exposed, sensitive skin. This immediate care sets the stage for proper healing. Clients should also be instructed to avoid harsh skincare products such as retinoids, alpha-hydroxy acids, AHAs, or beta-hydroxy acids, BHAs, for at least 24 to 48 hours, or as advised by the practitioner. Gentle cleansers and lukewarm water are recommended for washing the face. Picking or scratching the skin must be strictly avoided to prevent irritation or scarring. Makeup can typically be applied a few hours after treatment, but mineral-based makeup is often preferred. Educating clients on these aftercare instructions is vital for their skin's recovery and the longevity of the treatment benefits. Regular follow-up appointments can also help monitor progress and adjust the skincare regimen. Potential side effects and complications. While microdermabrasion is generally considered safe, clients should be aware of potential side effects and rare complications. Common temporary side effects include redness or flushing, lasting a few hours to a day, mild swelling, tenderness or sensitivity to touch, dryness or flakiness, slight bruising, especially with higher suction settings. These are typically mild and resolve quickly with proper post-treatment care. It is important to manage client expectations by thoroughly explaining these possibilities during the consultation. Reassuring clients that these reactions are normal helps alleviate concerns. Proper technique and adherence to protocols significantly minimize these occurrences. More serious complications are rare but can include post-inflammatory hyperpigmentation (PIH), especially in darker skin types if not properly protected from sun, herpes simplex flare-ups, cold sores, allergic reactions to crystals, rare, infection, extremely rare with proper hygiene, scarring, if performed too aggressively or on compromised skin. Practitioners must be vigilant in identifying contraindications and adjusting treatment parameters to prevent these issues. Immediate cessation of treatment and appropriate medical referral are necessary if severe or unexpected reactions occur. Comprehensive training and adherence to safety guidelines are paramount to ensure client well-being and prevent adverse outcomes. Hygiene and sterilization. Maintaining impeccable hygiene and strict sterilization protocols is non-negotiable in any aesthetic practice, especially when performing microdermabrasion. This ensures client safety and prevents the spread of infections. All equipment that comes into direct contact with the client's skin, such as handpieces and diamond tips, must be thoroughly cleaned and disinfected or sterilized after each use. Disposable components, like crystal cartridges or single-use tips, must be discarded immediately after a single client. The treatment room itself must be kept meticulously clean, with surfaces disinfected between clients. Adherence to these standards protects both the client and the practitioner. Personal protective equipment, PPE, for the practitioner is also essential. This includes wearing clean, disposable gloves for every client, and often protective eyewear to shield against airborne particles, especially with crystal microdermabrasion. Hand hygiene, including thorough washing and sanitizing, is a fundamental practice before and after each client interaction. All linens, towels, and drapes used during the treatment must be clean and either single-use or laundered according to strict hygiene standards. Implementing a comprehensive infection control plan is a legal and ethical requirement, reflecting professionalism and commitment to client well-being. Regular audits of hygiene practices help maintain high standards. Safety standards and regulations. Adhering to established safety standards and regulations is paramount for any professional offering microdermabrasion services. These standards are typically set by local, state, or national health and beauty regulatory bodies. They cover various aspects, including facility requirements, equipment maintenance, practitioner qualifications, and client consent procedures. Practitioners must ensure their practice space meets all sanitation and safety codes, including proper ventilation and waste disposal. Regular inspections by regulatory authorities help enforce compliance and protect public health. Staying informed about current regulations is a continuous responsibility for all practitioners. Specific regulations often dictate the level of training and certification required to perform microdermabrasion. Some jurisdictions may require a licensed aesthetician or medical professional to perform the procedure, while others might have specific microdermabrasion certifications. It is the practitioner's responsibility to verify and maintain all necessary licenses and insurance coverage. Furthermore, obtaining informed consent from every client before treatment is a legal and ethical obligation. This involves explaining the procedure, potential risks, benefits, and alternatives, ensuring the client fully understands and agrees to the treatment. Compliance with these standards not only ensures legality, but also builds client trust and professional credibility. Client record keeping. Meticulous client record keeping is an indispensable part of professional microdermabrasion practice. Comprehensive records serve multiple purposes, including tracking client progress, ensuring continuity of care, and providing legal protection. Each client file should include personal contact information, detailed medical history and contraindications, signed consent forms, initial skin assessment notes, treatment parameters for each session, for example, crystal type, grit, suction level, number of passes, post-treatment observations and recommendations, before and after photographs. These records provide a complete history of the client's journey and treatment efficacy. Accurate documentation is a hallmark of professional practice. Effective record keeping allows practitioners to tailor subsequent treatments based on previous outcomes and client responses. It helps identify patterns, such as sensitivities or optimal settings for specific skin types. In the event of a client complaint or adverse reaction, detailed records are crucial for demonstrating due diligence and proper procedure. They also facilitate communication with other healthcare professionals if a referral becomes necessary. Confidentiality and secure storage of client records are paramount, adhering to privacy regulations such as HIPAA or GDPR. Implementing a standardized record-keeping system, whether digital or physical, streamlines operations and enhances overall client management. Combining treatments. Microdermabrasion can often be effectively combined with other aesthetic treatments to enhance overall results and address a wider range of skin concerns. This synergistic approach allows for more comprehensive skin rejuvenation. For instance, following microdermabrasion with a hydrating or soothing facial mask can replenish moisture and calm the skin. Exfoliation from microdermabrasion also improves the penetration of active ingredients from serums or specialized treatments, making them more potent. Combining treatments requires careful consideration of skin sensitivity and the order of procedures. The goal is to maximize benefits without overstressing the skin. Popular combinations include microdermabrasion, followed by light chemical peels, e.g. lactic or glycolic acid, for enhanced exfoliation and brightening. LED light therapy, to reduce inflammation, promote healing, or stimulate collagen. Oxygen facials for deep hydration and revitalization. Customized facials with targeted serums and masks. When combining treatments, it is crucial to understand the individual effects of each procedure and how they interact. The practitioner must assess the client's skin tolerance and adjust the intensity of each component accordingly. Proper timing and sequencing of combined treatments are key to achieving optimal and safe outcomes, ensuring the skin remains healthy and responsive. Advanced techniques. Beyond standard microdermabrasion protocols, advanced techniques can be employed to target specific, more challenging skin concerns or to optimize results. One such technique involves varying the pressure and number of passes in specific areas. For example, areas with deeper scarring or stubborn hyperpigmentation might benefit from more aggressive passes or higher suction, while delicate areas require a very light touch. This customized approach allows for greater precision and tailored treatment outcomes. Understanding how to modulate these parameters based on individual client needs is a hallmark of an experienced practitioner. It requires a keen eye and a deep understanding of skin responses. Another advanced application includes using microdermabrasion as a preparatory step for other advanced treatments, such as certain types of non-ablative laser therapies or deeper chemical peels. By removing the stratum corneum, microdermabrasion enhances the efficacy and penetration of subsequent treatments. Targeted microdermabrasion for specific concerns like stretch marks on the body or very localized sunspots also falls under advanced techniques. Practitioners may also experiment with different crystal types or diamond grit sizes to achieve specific results. Continuous education and practical experience are essential for mastering these advanced applications and ensuring client safety and satisfaction. Maintenance and longevity. Achieving and maintaining long-term results from microdermabrasion requires a combination of consistent treatments and diligent home care. A single microdermabrasion session can provide immediate improvements in skin texture and radiance, but sustained benefits are typically seen with a series of treatments. The frequency of these sessions depends on the client's skin concerns, type, and response to treatment, usually ranging from every 2 to 4 weeks. Establishing a realistic treatment plan during the initial consultation is crucial for managing client expectations. Regular maintenance sessions, perhaps every 1 to 3 months, can then help preserve the achieved results. Home care plays an equally vital role in extending the longevity of microdermabrasion benefits. Clients must adhere to a consistent skincare regimen that includes gentle cleansing, moisturizing, and, most importantly, daily broad-spectrum sun protection. Incorporating active ingredients like antioxidants, peptides, and mild hydrating serums can further support skin health and cellular renewal. Avoiding harsh exfoliants or abrasive products between professional treatments is also important to prevent overexfoliation and irritation. Educating clients on the importance of this holistic approach empowers them to actively participate in maintaining their skin's improved condition. This partnership between practitioner and client is key to lasting success. Product knowledge. A comprehensive understanding of skincare products is essential for practitioners offering microdermabrasion. This knowledge allows for informed recommendations for pre-treatment preparation and crucial post-treatment care. Pre-treatment products typically focus on gentle cleansing and balancing the skin's pH. Post-treatment products, however, are critical for soothing, hydrating, and protecting the freshly exfoliated skin. These should be non-irritating, fragrance-free, and designed to support the skin's barrier function. Knowing the ingredients and their benefits helps in selecting the most appropriate products for each client's unique needs and skin type. This ensures optimal healing and enhances treatment outcomes. Key ingredients to look for in post-microdermabrasion products include hyaluronic acid for intense hydration, ceramides to support the skin barrier, niacinamide for soothing and reducing redness, antioxidants like vitamin C and E for protection, peptides for collagen support. Crucially, a broad-spectrum sunscreen with zinc oxide or titanium dioxide is non-negotiable for daily use. Practitioners should be able to explain the benefits of these ingredients to clients, empowering them to make educated choices for their home care regimen. Recommending professional-grade products that complement the treatment helps maintain results and prevent adverse reactions. Continuous education on new product formulations is also beneficial. Business aspects. Marketing. Effective marketing is crucial for attracting and retaining clients for microdermabrasion services. Developing a clear brand identity that communicates professionalism, expertise, and results is the first step. Utilizing a multi-channel approach can reach a broader audience. This includes creating a professional website with detailed service descriptions and client testimonials, leveraging social media platforms, e.g., Instagram, Facebook, with engaging before and after photos and educational content, running targeted online advertisements. High-quality visuals and compelling narratives are key to capturing attention. Understanding the target demographic helps tailor marketing messages for maximum impact. Offline marketing strategies can also be highly effective. This involves offering introductory packages or loyalty programs, collaborating with complementary businesses, e.g., spas, dermatologists, hair salons, participating in local health and beauty events, distributing informative brochures or flyers. Word-of-mouth referrals remain a powerful tool, so encouraging satisfied clients to share their experiences is invaluable. Providing exceptional service and consistent results naturally generates positive reviews and recommendations. Continuously analyzing marketing efforts and client feedback allows for adaptation and refinement of strategies, ensuring sustained business growth and a strong client base. Business aspects. Pricing. Determining appropriate pricing for microdermabrasion services is a critical business decision that impacts profitability and market positioning. Pricing strategies should consider various factors, including cost of equipment and supplies, practitioners' time and expertise, overhead expenses, rent, utilities, insurance, local market rates and competition, perceived value of the service. Researching what competitors charge in the area provides a benchmark, but pricing should also reflect the quality of service and unique selling propositions. Offering different price points for single sessions versus package deals can attract a wider range of clients. Transparent pricing builds trust and avoids client confusion. Value-added services and packages can also influence pricing. For example, offering a series of microdermabrasion treatments at a discounted rate encourages client commitment and repeat business. Bundling microdermabrasion with complementary treatments, such as a hydrating mask or LED therapy, can increase the perceived value and average transaction value. Clearly communicating the benefits and expected results of the treatment justifies the price point. Regularly reviewing and adjusting pricing strategies based on market demand, cost fluctuations, and client feedback is essential for long-term business success. The goal is to set prices that are competitive, profitable, and reflective of the high-quality service provided. Professional ethics and client communication. Upholding professional ethics and fostering excellent client communication are foundational to building a successful and reputable microdermabrasion practice. Ethical conduct includes honesty, integrity, and always prioritizing the client's well-being and safety. This means being transparent about treatment capabilities, potential risks, and realistic outcomes. Never over-promising results or pressuring clients into unnecessary treatments is crucial. Maintaining strict confidentiality regarding client information and treatment details is also a core ethical responsibility. A strong ethical framework builds trust and ensures a positive client experience. It reflects the practitioner's commitment to high standards. Effective client communication involves active listening, clear explanations, and empathetic engagement. During consultations, practitioners should listen attentively to client concerns and answer all questions thoroughly and patiently. Explaining the microdermabrasion procedure, sensations, and post-treatment care in easy-to-understand language empowers clients to make informed decisions. Providing clear written instructions for aftercare reinforces verbal advice. Addressing any client discomfort or concerns promptly and professionally during or after the treatment is also vital. Building rapport through respectful and open communication fosters long-term client relationships and enhances overall satisfaction. This professional approach elevates the client experience beyond just the treatment itself. Summary and future trends. Microdermabrasion remains a highly valued and effective, non-invasive treatment for improving skin texture, tone, and overall appearance. This course has covered its fundamental principles, including skin anatomy and physiology, various treatment types, and essential protocols for both facial and body applications. We have emphasized the critical importance of client consultation, safety standards, hygiene, and meticulous record-keeping. Understanding potential side effects and providing comprehensive post-treatment care are also vital for ensuring client satisfaction and optimal results. The diploma provides a solid foundation for practitioners to confidently and ethically offer this popular aesthetic service. It equips professionals with the knowledge to deliver safe and effective treatments. Looking ahead, the field of aesthetic treatments, including microdermabrasion, continues to evolve with ongoing research and technological advancements. Future trends may include integration with AI for personalized skin analysis and treatment planning, development of even more refined and specialized handpieces or abrasive materials, enhanced combination therapies with other advanced modalities, greater emphasis on sustainable and eco-friendly practices in product development and clinic operations, expansion of at-home microdermabrasion devices with professional guidance. Staying abreast of these emerging trends and committing to continuous professional development will be crucial for practitioners to remain competitive and provide cutting-edge services in the ever-changing aesthetic landscape. The future promises exciting innovations in skin rejuvenation.